Well, my name is Mike Broadbent. Today we're going to talk a little bit about wisdom teeth and some of the things associated with the surgery, as well as post-operatively kind of what to expect with the procedure as well. We're excited to be able to see you and talk to you about the opportunity you have to have your wisdom teeth out. We know it's not one of those things that everybody is always looking forward to, but we hope that we can make the experience the best that we can and that you have a good outcome with the surgery as well. As you look at the wisdom teeth, there's a lot of things that are associated with it. Most of the time there's not enough room, and so that's the time that we look at taking those wisdom teeth out. It's a lot easier to deal with this when you're young and healthy versus if they cause problems in the future. There's potentially more risks and complications that can occur as we do that in the future. And so with the wisdom teeth, as you can see over time, food and bacteria can get caught down in these areas where these teeth can get cavities on them, as well as the adjacent teeth. Sometimes even impacted teeth can develop a cyst or a tumor that occurs in the jaws that we have to watch for as well. And so therefore is a good time to consider doing that. Some of the things that we talk about, typically we recommend about 3 to 4 days afterwards just to kind of take it easy. So where you don't have too many strenuous things going on like exercising, sports, activities, those types of things. And most of the time after about 3 to 4 days, most people kind of bounce back pretty good and are doing well post-surgery with their recovery. The foods that we recommend are kind of soft, not hard, crunchy types of foods. So for the first 3 or 4 days, definitely want to be on soft, mushy type foods. We want to make sure that you keep yourself well hydrated so that you don't get nauseated or have other things that come up. So keeping yourself hydrated is very important. Some small risks with the surgery that we always talk about, such as pain, swelling, bleeding. Infection is a very small possibility as well. Damage of other teeth in the areas that we're working on. Above the teeth on top, when we take out top wisdom teeth, we have our sinus cavities that we all deal with allergies and other things like that. So as we take out top teeth, sometimes there can be a small opening or a communication between the mouth and the sinus. If that were to happen, we see it during the procedure. We tell you about it, tell you what to do, put some stuff inside of there, suture it up. And most of the time those will heal up without any problem. In very rare occasions there can be an additional surgery that can be necessary. But again, that's one of those things that we kind of follow and watch that way. With the lower jaw, there's a nerve that comes down through the lower jaw, and that nerve supplies the feeling and the sensation to our lip and to our chin. So as we take out the bottom wisdom teeth, there's a very, very small chance that nerve can get bumped or bruised as the teeth come out. So as the roots come out, sometimes they can just bump or brush that nerve a little bit. If that occurs, it sometimes can cause some numbness or some tingling of the lip and the chin area. Usually if that occurs, it is temporary and it goes away, but it can last up to a few weeks, even a few months, and most of the time those will resolve. One of the things that we want to make sure is that your experience post-operatively is the best that we can make it, and so we're very concerned about your pain and how we manage that for you. One of the things that we're trying to do is minimize the amount of opioids and the narcotics that we're prescribing, but at the same time make sure that your pain is managed appropriately. So we recommend starting off with ibuprofen and Tylenol first, and then we will supplement it with another type of pain medicine based on the surgery and different things like that. And it's something that we definitely want you to talk to us about so that we can make sure that we understand what works for you if you've had surgeries in the past, so that we can manage your pain the best way that we can. There's another thing that we can do as well. A product called Exparel. What Exparel is it's a local anesthetic or a numbing medicine that we can inject into the surgery sites around it, and it keeps those areas numb for about 3 days. So the advantage of that is that the pain is definitely diminished and reduced. It doesn't take away all pain, but most patients are getting by with, for the most part, ibuprofen and Tylenol. So it's an option if you want to do that, and we can have that discussion about that as well, so that we can best manage that pain post-operatively. So we're excited to be able to see you and take care of you and hopefully help you through this process and make it the best experience that we can.